Good afternoon, dear listeners and viewers of Equinoxe Radio Multimedia. You're welcome to your health program, You and Health, aired on Equinoxe Radio Multimedia for presentation. I am Isia Lucy Liengu. Infertility affects millions of people worldwide and has an impact on families or within families and communities. Reports indicate that 6 out of every 6 people of the reproductive health worldwide experience infertility in their lifetime. In the male reproductive system, infertility is mostly common and caused by several problems and also by problems in the injection of the spermatozoa. Infertility can be primary and secondary. Today we'll be looking at the causes of infertility in men, how it can be treated or prevented. With me here in the studio is Nurse Marivon AGBOR. Good afternoon, nurse.
Yeah, absolutely.
And also, just to recall that you are a sexual health expert. It's a pleasure having you on today's edition. Straight away, without any waste of time, we begin with our first question. We want to know, when we talk about infertility in men, what is it all about?
Now, before we go into infertility in men, let's look at the general term infertility.
Yeah.
Infertility as a term is the inability for couples to conceive after a year of continuous unprotected intercourse. And now we have primary infertility and secondary infertility. Primary infertility is when a couple have never had a child before, while secondary infertility is when a couple have had a child and they are struggling for a year or more to have another child. Now, infertility in men is the inability of a matured male adult to impregnate a fertile female. Because when we are talking about infertility, we are looking at the maturity of the man in question and if the partner is actually fertile.
And what are the common causes of infertility in men?
Well, we have low sperm counts. We have things like oligospermia. Now, talking about oligospermia, it means the sperm count is not enough according to WHO. WHO reports that a sperm needs to be of about 15 million per milliliters. So if the sperm count is not up to 15 million, then it is low. We have things like azoospermia. Azoospermia is no semen in sperm because it is actually semen that carries sperms. We have things like epididymitis, which is an inflammation of the epididymis. We have things like the prostatitis, inflammation of the prostate. We have otitis, the inflammation of the testes. Now we have things like medical conditions like diabetes and hypertension, which could eventually cause infertility. We also have medical treatments like chemotherapy and certain antidepressants and even steroids, which could expose one or make one a victim of infertility.
And now, before we continue, I would like to give out the numbers out there for those who like to participate in today's edition of your program, You and Health. We have 670-5470-49, 670-5470-49, or 656-622222. I repeat, 656-622222 at the end. And back to you, nurse, who would like to understand what is the prevalence rate of infertility in men in our country.
In our country, Cameroon, according to Divine Reproductive Health Report, it states that we have a percentage of about 40 to 50% of men who are infertility victims. Yeah.
And are they similar to that of women? Because we know that in our African setting, it is mostly said that when we have infertility, mostly concerns by the woman. Most people forget about the aspect of men being infertile in a relationship or in marriage.
It's actually ironical that people don't know the percentage of women is not even up to that of men. Yes, it's about 15 to 30%, while that of men is about 40 to 50%. So you see that the percentage of men suffering from infertility is slightly more than that of women.
Now, it's more than, what are some of those factors that contribute to this? Can we say a diet, exercise, and other factors can lead to a man being infertile?
Yes, definitely. In as much as water is important to plants, diet and exercise is also important to the human system and infertility as a factor. Now, we need to understand that food and or dietary has a lot to do in your health system. When you feed poorly, first of all, your immune system is not balanced. You have hormonal imbalances. So it's important to feed well, especially when we're talking about dieting. We are looking at things like omega-3 fatty acids. We are looking at vitamin D. Yes, and we are expecting people, men, to feed well, because if not, you'll be prone to to infertility. And exercise too is very important because it helps to antioxidize the body. You know, when you do exercise, it sends out waste metabolism. So if you're not exercising, it's like you're inculcating that in your system. Like you're not sweating, you're not exercising, your body is stagnant. And so when this happens, of course, you are prone to be a victim of infertility.
What role to say does hormones play in infertility in men, and how can this be accessed?
Now, in every reproductive system, especially in men, we cannot talk about it and underestimate the role of hormones. And one of the major hormones in the male reproductive system, we have testosterone, we have inhibin, and there are so many of them. We have gonadotropin. Yes, so these hormones, they help to, first of all, they take part in spermatogenesis, which is the process of the production and maturation of sperms. They help in sperm quality. They also help in the motility of sperm. That is how sperms can migrate and move to the reproductive tract to fertilize an egg. They also take part in the DNA integrity of a sperm. So now, when these hormones are not stable, they are not in order, or they are higher or lower than the normal rates, it definitely affects the fertility of men and makes one to be prone to infertility. Now, for us to assess the hormones, first of all, we look at semen analysis. By semen analysis, we are examining the sperm counts, we are checking out the sperm quality, we are checking out the shape of the sperms. Now, we are talking about shape of the sperms. There's a particular way a sperm looks like. You know, it has an overhead shape, it has a mid-piece, it has a tail, it has a cystoplasmic droplet. So all these things are taken into consideration to assess hormones. And also, we check about the hormonal level. That is where we know if your hormones are up to standard, if the quantity is actually high, low, or normal.
And ladies and gentlemen, we are talking about infertility men. You may have been experiencing this challenge in your marriage, in your marital home, wherein your wife is unable to give birth or to give birth to a child, or maybe you are accusing or you are being accused by the family that you are unable to give birth to a child, you're unable to have a baby. This is a time for you to ask your questions. We are talking about male infertility. What are the causes? How can it be prevented? We are talking about this with the sexual health expert. So it's the time for you to ask your questions. I repeat the number on our screen. We have 67054 7049 656 2222 656 622222 at the end. And now, nurse, we want to know what are the tests that can be conducted in order to diagnose this health condition.
Okay, before I said, I want to address something. Sometimes in the society, we just look at somebody or just be like, the man of you born, the man of you, which is very wrong. You don't dictate infertility by just your physical eyes.
We have a caller on the line. Hello? Hello?
Hello, it's Joshua.
Good afternoon. Where are you calling from?
Hello. I'm calling from Babuta.
Thank you. Your question, sir.
No, I have been talking on something else, so I wanted to ask if people are working on it, or somebody can have a medication for it.
A medication for infertility in men?
Yes.
All right, you can call this same contact after the program for your question or answers.
And which location? Okay.
We'll give all the details at the end of the program. Thank you very much. For those who are asking questions on how this condition can be treated, or maybe you want to get to the nurse, you can call this same number after the program. Yes, you're explaining something.
Okay, now I think we're talking on
how it can be diagnosed.
How it can be diagnosed.
Yes.
So earlier, you can't just look at someone and say, oh, you are infertile. Now, there's a couple of steps we take before we could conclude that a man is actually infertile. We do physical examination. We examine the testes. We examine the prostates. We examine the epididymis. Now, when we go to lab exams, we do what we call semen analysis, where we actually do sperm counts.
You have another caller on the line. Hello?
Hello?
Yes, sir. Your name and where you're calling from.
I want to participate in the program.
Thank you. Your name and where you're calling from.
Yeah, I'm Gilbert. I'm calling from Limerick.
Thank you. You're welcome. And your question?
My question is genetic factor of infidelity? Sorry for
infertility.
Infertility.
Is
Yes.
genetic a problem of infertility? Thank you for your question.
Yes, genetic is actually one of the causes, or it's a factor in infertility. We have what we call the Klinefelter disorder, which is indeed a genetic disorder.
All right, so we are talking about how it can be diagnosed.
Okay, now I've earlier mentioned about physical examination, and now we go to the lab. In the lab, we do what we call semen analysis, where we check the semen, the sperm count actually. I talk about motility. Motility, we are checking on how the sperms can actually swim, because there's a speed at which a sperm actually needs to swim. They check the shape, the motility, the shape and the structure of the sperm. They check the quality of the sperm. And now there are also ultrasounds. These are what people don't know. There are ultrasounds. They what we call the scrotal ultrasound, where they check the scrotum. Yes. There's what we call the transcranial ultrasound. There's an imaging resonance ultrasound. So all these things, we do them to make sure, to check and analyze and come to a conclusion before you say someone is actually infertile. You don't do just one and conclude. No, this is a procedure that needs to be taken before conclusion.
And now, how can it be treated? We want to know.
The treatment of infertility is very vague. And I think this is where we have a problem in Cameroon, because your neighbor had infertility issues and bought one drug somewhere. You just, because you heard he worked for him, you just went and you just want to buy yours and use. Meanwhile, the two of you might not have the same problem. So the treatment of infertility, first of all, depends on your cause. Now, but the general treatment, we have hormone replacement therapies. Yes, we have things like testicular biopsy. Now, for those who have obesity, because obesity is also a factor of infertility, you make sure they'll put you on a dietary to watch your weight. Yeah, there's what we call varicocele. Now, by varicocele repair, it means that we are repairing the inflammation of the veins that are found in the scrotum. So these are all a form of treatment. And also, in access to this, there's also an antibiotic treatment for those whose infertility is from the root cause of infection, because there are people whose problem comes from infection, bacterial infection, and even STIs. Yeah.
And any other, we have a caller on the line. Hello.
Hello.
Good afternoon, sir. Where you're calling from and your name?
I'm calling from Kizange.
Kizange. Welcome to the program and your question.
My question is about I want to ask whether honesty is for the
I can't get you, sir. Can you be a little bit audible? I can't get you clearly.
Je posais la question de savoir s'il y a un traitement pour la fertilité.
Je vous écoute pas très bien. Please, if you want to ask your question, ensure that your receiver is turned off. We have another caller on the line. Hello.
Hello, good afternoon.
Good afternoon, sir. Your name, where you're calling from?
Yes, this is Nyam Christopher from Bole Bapundu under Bonge subdivision.
Wow, welcome, sir. Your question.
Yes, I want to find out from the doctor. The is due to painful testes. You know, sometimes there are painful testes. Can it result to infertility? Thank you.
Thank you for your question. You heard the question, nurse.
Yes, it can. We earlier said prostatitis, that's inflammation of the prostate gland, is also one of the causes. And we have what we call orchitis, which is the inflammation of the testes. It's actually a potential cause of infertility. So if someone is experiencing a pain in the testes or swelling, it's important for you to go and consult, because you don't know the end result of it or what the damages it has caused already in your system. So yes, it's a cause of infertility.
Let's continue with some of the treatment. You made mention that maybe you have this condition, infertility, and because it worked for your friend, you think that it can also work for you. What about those who go traditional? We have another call on the line. Hello.
Ouais, bonjour.
Bonjour, monsieur.
Ouais, bonjour.
Bon après-midi. Votre question, là, vous appelez.
Oui, j'appelle pour ça depuis le droit là.
Ok, merci. Votre question.
Oui, je m'appelle Michael. Je veux savoir, parce que j'ai fait un enfant avec un enfant. On n'a plus encore d'enfant. On fait tout pour tout l'enfant ne vient pas.
Oh, ok. Merci pour votre question. he is raising the concern that he has a child, and after that, he has been struggling with his wife to have another to no avail.
Okay, that's secondary infertility.
Secondary.
Yes.
Yeah, can you expatiate on that so you can understand?
Okay, now the secondary infertility, you've had a child, and now you're finding difficulties to conceive another. With this, I cannot even give any prescription because I don't know what actually has caused the secondary infertility.
What is the cause?
Yeah, the particular cause of it. So it's important he goes for consultation and have a follow-up. So because when he consults from there, they will assess him, maybe send him to a particular exam and know the root cause of the secondary infertility, and then they can treat it.
Donc, monsieur, vous avez compris, il faut aller à l'hôpital et voir le médecin. And now, doctor, nurse, to say, we were talking about those who equally go for traditional medicine as a cure for infertility men. Is this actually advisable?
I can't really say much about that, but what I can say is, I don't know how effective it is, but what I can say is, you don't just dive into something you don't know the root cause. One of the disadvantages of these traditional herbs that people buy around is that because you work for Elia said, your friend would tell you, you work for me, you just buy and use. You don't even know the cause of your friend's problem.
We'll come back to that. Hello?
Yes, good morning, madam.
Good afternoon, sir. Your name and where you're calling from?
Yes, my name is Mr. Dawai, calling from Gaundari.
Oh, thank you. Welcome to the program. Your question?
Yes, I would like to know whether there is a link between diabetes and infertility.
Okay.
Yes, there is a link.
Thank you for your question.
There is a link because diabetes damages the blood vessels and the nerves. And when this happens, of course, enough blood will not flow right through to the reproductive tract. And this could actually hinder fertility and cause infertility. Because every part in your system depends on your blood vessels and actually the veins, because blood flows. Blood supply is very important in the body. That's why when you're anemic, a lot of things could actually go wrong. So, of course, diabetes is a potential factor. Cause of infertility. I think we earlier mentioned that.
Sure. How effective are assisted reproductive technologies? We have the ART for treating male infertility.
Assisted reproductive technology is one of the most effective ways of treating infertility in male. Reasons that before any of the procedures has been carried out, because we have different procedures. Yes, we have different procedures. We have the transcystoplasmic single injection, by which they take a single sperm and inject it to an egg fertilization. We have the IVF.
On the line. Hello.
Hello.
Yes, sir. Good afternoon. Your name and where you're calling from?
Good afternoon. My name is from Buya.
Welcome to the program. Your question?
My question is how hypertension will cause infertility in men.
Okay. Thank you. Any other question?
That is the first question for now.
Thank you. Follow the program, get the answer. How can hypertension lead to infertility?
Now, in a layman language, hypertension is simply I want to explain something. It's simply the pressure that has been exerted on the walls of an artery. So when this happens, of course, definitely, it affects the blood pressure. And as I earlier said with the diabetes, explaining how diabetes could destroy the nerves and blood vessels. We earlier said blood plays a vital role in the human system and, of course, in the reproductive system as well. So when you have medical conditions like maybe diabetes or hypertension, it hinders the actual blood flow that your body needs. And, of course, even energy, oxygen too is being interrupted. And so hormones too will definitely be affected, and this could lead to infertility in the long run. And also there are some antihypertensive drugs, as we earlier said, that some medications could cause infertility. So there are some antihypertensive drugs that could cause infertility in some particular patients.
Let's quickly talk about the another call on the line. Hello.
Yes, good afternoon, madam.
Good afternoon, sir. You're welcome to the program. Your name and where you're calling from?
Please, I have a worry. I'm Henry Sampson, I'm calling from Bafusam.
Your question, thank you.
Okay, the question is, my own issue of infertility, I want to really know is how can they post it? How can somebody improve on it if you notice that you have it?
Okay.
First of all, you cannot just notice on your own that you're infertile, though you could actually have some signs or some symptoms. Having signs and symptoms is not a conclusion because you don't have a lab or equipment in yourself to know that this is wrong. You go to the hospital. After earlier, when you are consulted, you are checked. They will put you on treatment on how to properly manage. We don't encourage over-the-counter drug or self-medication and self-treatment. It is important you give yourself to a medical personnel for proper follow-up.
Briefly, let's give the last advice. How can infertility affect a man's mental health, and how can we address this situation within the couple?
Okay. Normally, men who are facing infertility, especially in Africa and Cameroon in particular, they have low self-esteem. You just be like, I'm insufficient, I cannot do this. And so most of them are prone to depression, anxiety, and all that. They tend to have mood swings, mood swings and anger. And this could lead to suicidal thoughts. Because, you might want to discipline a child, someone's child, and neighbor will just be like, I beg, come on for you, go born your own picky, you think it's easy. So that puts you into depression. So infertility is actually a tool for depression for the men, the victim men. And now for couples to cope with this, the first thing we advise is open communication. Infertility is not a no man's joke. It's not something to just joke around with. It's something that can put you down emotionally and physically. So as couples, discuss openly with your partner, express your fears. Also attend conferences. Also listen to programs, watch programs that talks about infertility. This will help you and guide you on how to go. Also do research. One of our issues in Cameroon is that we don't study. We think anything medical is left only to the medical person. There's no, do research about yourself. Be educated and also invest. So for you to handle infertility, you need to invest in medications. Get a doctor. Don't just be like, don't be 5 years. I never get picking. I define picking. I need to see but you never go hospital. You don't have any doctor following you. You are not taking treatments and all that. So how do you want to get solution? And it's important you also keep positive company. By positive company, I mean people who don't mock you because of your situation, because it can lead you to suicidal thoughts. So have people who cheer you up to your solution, and especially people who give you right medical counsel.
Thank you very much, Nurse Marivon AGBOR, for honoring our invitation today, as usual.
Thank you, Tony, for having me.
Sure. For presentation, I am Esie Lucy Liengu, and at the technical dashboard, we had Bertrand Bonsoni and Jonathan Babiola. Sure, we'll leave in the company of interesting program, but we'll meet again next week, Thursday, same time, 12:30 to 1 p.m.